Hospital-acquired infection. A hospital-acquired infection, also known as a nosocomial infection, refers to an infection that is contracted during a hospital stay or visit, but was not present or incubating at the time of admission. These infections can be caused by a wide range of pathogens, including bacteria, viruses, fungi, and parasites. Here are some key points about hospital-acquired infections. Causes. Hospital-acquired infections can occur due to various reasons. They may result from exposure to pathogenic microorganisms present in the hospital environment, contaminated medical equipment, improper hand hygiene by healthcare workers, or invasive medical procedures that introduce germs into the body. Common types. The types of hospital-acquired infections can vary, but some of the most common include urinary tract infections, surgical site infections, bloodstream infections, such as sepsis, pneumonia, and gastrointestinal infections. Risk factors. Certain factors increase the risk of acquiring an infection in a hospital setting. These include prolonged hospital stays, intensive care unit, ICU, admission, invasive procedures, such as surgeries and catheterizations, weakened immune system, underlying medical conditions, and improper implementation of infection control measures. Prevention. Hospitals employ various strategies to prevent and control hospital-acquired infections. These measures may include strict adherence to hand hygiene protocols by healthcare workers, routine cleaning and disinfection of patient care areas and equipment, proper sterilization techniques, appropriate use of antibiotics, isolation precautions for infected patients, and vaccination programs. Consequences. Hospital-acquired infections can lead to increased morbidity and mortality rates, prolonged hospital stays, higher healthcare costs, and additional complications for patients already dealing with other medical conditions. These infections can also contribute to the development of antibiotic resistance, making treatment more challenging. Surveillance and monitoring. Hospitals typically have surveillance systems in place to monitor and track the occurrence of hospital-acquired infections. By collecting data on infection rates, specific pathogens, and antibiotic resistance patterns, healthcare facilities can identify trends, implement targeted interventions, and continuously improve infection control practices. Patient education. Patient involvement is crucial in preventing hospital-acquired infections. Educating patients and their families about infection control measures, encouraging active participation in their care, and promoting awareness of the signs and symptoms of infections can help reduce the risk of acquiring an infection during a hospital stay. It's important to note that while hospitals strive to provide safe and sterile environments, the presence of pathogens and the risk of infections can never be completely eliminated. However, with proper infection control protocols and vigilant monitoring, healthcare facilities can significantly reduce the incidence of hospital-acquired infections and improve patient safety.